All right. I don't know if this happens to y'all, but when you're connecting to live, does it take forever? I'm going to just start doing it like 10 minutes early. I'm kidding. Hey, y'all. Hey. All right. I'm giving you guys some time to get into the room. All right. Hello, everybody. Hello. All right. So today... All right, so you guys know, hey, I'm Nurse Sam, and this week we have, basically it's going to be, it's called the final stretch, all right, and that's our campaign for this week. And what that is some of you guys may be taking finals, some of you guys may be prepping to take your ATITs or your HESI entrance exam, no matter what it is, or even the NCLEX, no matter what it is, you basically have to have the same foundation and concept, okay? Like I said earlier, especially for NCLEX in nursing school, knowing the content is only half the battle, okay? What you also need to know how to do is how to evaluate the question and identify what it's really asking you, okay? Because especially with NCLEX nursing school, it's not as black and white as what is the powerhouse of the cell. It's just not that black and white because they're not testing you on your ability to remember content. If you didn't really do that well in school or remembering content, you wouldn't have gotten into the program. What they're testing you on now and what they're trying to train you into doing now is that clinical judgment, critical thinking. So they're going to ask you questions on whatever exam, whether it be NCLEX or ATI exit or one of your chapter finals for your semester. They're going to ask you questions that are going to test whether or not you comprehend the information and can critically think about the client's needs as well as their safety. So there's a couple of strategies in like test taking tips and strategies that I definitely want to share with you guys. Because before I started doing these, mind you, I'm out of school. I've been out of school for 8 years. When I started nursing school, if you guys don't know, I was a musical theater major. So I was used to memorizing. That's all I had to do was memorize. I didn't have to comprehend the play. So, memorizing wasn't the hard part for me. What was hard for me was being able to, like I said, evaluate the question, identify what it's asking, because like I said, it's never straightforward. I've never had select all that apply. I've never had questions that were like double negatives, like which would require further teaching. So those are like little things that I had to learn as I went along with my nursing school. I did LPN, so it was 12 months. / a year. So in the first semester, I would say half the first semester, like I super struggled because I didn't know these strategies. And once I started like really learning the strategies, practicing them, it got easier for me as far as answering those questions because I was then able to sometimes even get the question correct without really 100% knowing the content. And that's because I can identify what they're really asking. Does that make sense? Let me see what y'all saying. Ew. When I answer questions, I go, woo, Mama Mia, you passed your T's. Sorry, y'all. Yesterday was T's Tuesday, and my girl, Mama Mia, passed your T's. Oh, I am so proud of you. Oh, I'm so proud of you. DM me. Maddie Lee took my T's and passed. All right. Oh my gosh, y'all, do not make me cry. Okay? Hey, y'all. Hey. Oh, my God. I'm so happy. Hey, Paige, Jade, Tijuana, Juice. Oh, my gosh, Mama Mia. I'm just so proud of you. Maddie Lee, I am so proud of you. Awesome job, guys. So, if y'all don't know, those are, on Tuesdays, I do Tease Tuesday, where it's the same thing as NCLEX Jeopardy that we're doing tomorrow, but they're just with ATITs. Yesterday, in the live lineup, I did the difference between ATIT 6 and 7, and then we went into NCLEX Jeopardy, ATIT's Jeopardy, and some those ladies have been faithful participants every week. It's every week for free on Tuesday, so great job, awesome. Yay! Yay! Wait, hold on. Future ER nurse, just finished your first nursing semester. Are you serious? I honestly thought you were in your last semester / already graduated and about to take the NCLEX. Because the way you be killing it, future ER nurse, the way you be killing it in NCLEX Jeopardy, great. Stay right there. Stay right there. Because I'm going to ask you how your experience was as far as nursing school. The worthy journey on my last semester. Naz starts LPN school next week. I got you some advice. So got you. Okay. Woohoo. All right, guys. So super proud. So like I was saying, the test taking strategies, especially for the NCLEX, mind you, whenever people ask me, hey, when should I start preparing for NCLEX? Your first day. Your first day. I don't care if it's your first semester. If this is the acceptance letter, go ahead and get your NCLEX books. You need to start practicing as early as possible so that you're not rushing and like panicking with super high test anxiety towards the end of whatever program you're in. So the sooner you get used to NCLEX style questions, so whenever you see your reviews, make sure it's NCLEX style questions so you can help develop those skills. All right. So first things first. You guys know I always say, what's the first thing I should do as far as, studying, learning, whatever in nursing school? Honestly, it doesn't matter if you're in nursing school or not. But because this is a nurse page, we're going to talk about nursing school, okay? The first thing I always suggest doing is making sure that you know your learning style. Do you know your learning style? If you don't, that's fine. It's fine. Quick Google. I always post about learning styles, but your learning style is going to be the key into you being able to retain and recall that content or whatever information is that you're digesting. Is going to make it easier to digest. Let me say it like that. Let me look at what I was saying. I took the exit T's. Yay, call me Bree-Love. Oh, valedictorian, period. Awesome. So, yes, your learning style. And if you guys don't know about learning style, like I have plenty posts on it. If you are in the study bar community, we have a whole kind of a blog about it, about learning your not nursing school, but your learning style. For me, specifically, my learning style is visual and interactive. So you can be visual, not interactive, visual, kinesthetic, which is basically interactive. You have to do things with your hands and actually be like an active participant in whatever it is that you're doing. That's kinesthetic. Visual is when you have to have colors and pictures and images and diagrams in front of you in order for you to really connect the pieces and put the whole picture together. You also have reading / writing, and that's just your traditional read, whatever it is you got to study. You'll do, usually people with just like reading, first of all, I don't know anyone that's just reading. I'm not saying nobody that's like that, it doesn't exist. Me personally, I don't know anybody like that. It's usually a combination of one. Of reading and something else, but I don't know anybody that's just reading. That's another thing. You can have more than one learning style. You can have like I said, I am visual and kinesthetic. All right, so I use both of those to really help me comprehend and digest the information. So, you don't have to just be one of the learning styles. So I said visual, I said kinesthetic, I said reading, writing. The other one is auditory. Auditory is when you have to listen to the content. So people that are really, that are auditory learners, they probably listen to podcasts, they probably listen to videos, like they probably go on YouTube and press those videos, and sometimes they'll watch it, but really as long as they hear it, they're good. But like I said, it's the auditory, it's the sound of it, and someone talking or a recording playing, that's how you really retain the information. And then, so I I said all four. Great. So like I said, you can be a combination of those things, or one off, just one of them. You can be. I haven't really heard of just one off, because usually people are a combination. All right. So after you learn your learning style, then you can shape your resources around the type of content that you need to digest and in that style. Like I said, if someone's an auditory learner, then they know that in order for them to really digest and comprehend the information, it would be better for them to listen to YouTube videos or podcasts or anything auditory in that nature, rather than just reading the books. Because let's be honest, the books in nursing school are like Harry Potter novel thick, maybe thicker. All right. So depending on your program, like LPN or registered nursing, and that's ADN or BSN, 12 months usually for LPN, 2 years usually for like your your associates in nursing, so your ASN for your RN, or it's 4 years for your BSN. And a lot of people think because LPN is the entry into nursing that it's the easiest, but that's not true. The reason why, mind you, it's all nursing school. So the reason why LPN is so challenging is because you only have that small time frame, those 12 months to learn all that content. So it's as accelerated as you can possibly think about as far as nursing school. So when you go to your first day or you have your first week, whatever, when you get your homework or assignment for that day, the teacher's like, you got to read this much for tonight, because by next week or a couple days after, we have to move on to the next chapter. So that's really what makes or a big chunk of what makes LPN school difficult. I'm not gonna say hard, difficult, because of the accelerated speed and the giant amount of content that you have to consume. So knowing your learning style is definitely going to be pivotal as far as, with all the stuff that you're taking in. How much of it are you really retaining and comprehending? Because I know for me, I could read a whole chapter, and when you ask me about it, I'm like, when did I read that? You have to learn with whatever style is going to make it stick. Okay? If you guys need more help on learning styles, like I said, I have plenty of posts, or just DM me, and I can send you that stuff. All right, future earners, if the words get jumbled together, reading those books. Same thing with me. There's also a lot of people that struggle with ADHD, and they don't find that out until like nursing school, or even maybe they've always been ADHD, but going into nursing school is going to be a new challenge for them. So I know that anybody that is ADHD, sitting down and reading and sticking to a task, like studying, especially for long periods of time, it's just not gonna work. It is not gonna work. Okay, so that's also something that you have to really know about yourself, so that you can make whatever tweaks and adjustments to make sure that you're learning whatever it is you need to learn, and it's sticking. Okay, so let me see what y'all saying. Is it worth it? Is what worth it? ADHD all my life. Somebody said, is it worth it? Is what worth it? Let me know. Have you ever thought about going back to school for RN? I did initially, but that is a no-go. When I say initially, I mean like right out of nursing school, and that's mainly because I was tired of y'all talking about me and being in my face. Not y'all specifically, saying that I need to be a real nurse and yada 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 yada. So I was really being pressured into being an RN, but that's a story for another day. But now I'm not even bedside. I'm completely retired. I'm a retired nurse. What I do now is focus 100% of my time, money, and efforts on making sure you guys get through nursing school with as little anxiety as possible, and having as much fun in passing your NCLEX. Okay, that's my goal. I want to make sure that you get into nursing school, get through nursing school, graduate, pass NCLEX, and become the bomb nurses that I know you can be. That is my goal, because I didn't have anybody that did that for me. So what I chose to do, instead of picking up some shifts and going bedside, is to make sure you guys go on to be great nurses. All right. And plus, I'm artistic and I love creating those study kits. That is definitely my gift and my calling. So I definitely wanted to do that. Let me see what else you guys are saying. Is LPN worth it? Absolutely, depending on what you want for your life. All right, so the next thing you should do as far as NCLEX test taking strategies, you need to read the whole question. Well, I would say break down the question. Understand what a question NCLEX style is really asking. Okay. Now, with that being said, you should know the different types of questions that you're going to have on your NCLEX or just a nursing school period, but specifically let's talk about NCLEX. All right. So types of questions on your exam. You guys know that you're going to have multiple choice. All right. Multiple choice is when you just have, you have your question and then you have usually 4 answer choices and you have to select one of those answer choices. That's just our traditional multiple choice testing question that you're probably going to see forever. The next type of test question type is fill in the blank. All right. Fill in the blank, that's kind of to the point. You have to literally fill in the blank to answer the question. Those can be tricky, are tricky because you don't have 4 of the possible answers in front of you. There is no possible answer in front of you. You just got a blank space. You got to write your name. I'm just kidding. Taylor Swift. You just have a blank space and you have to type in whatever that answer is. That's on one hand, it's really making sure that you know your stuff. And you're not, making an educated guess. You're really to the T and precisely putting in whatever the correct answer is. So usually you'll see those with like your dosage calculations, some pharmacy questions. You usually see those with like numerical answers. And one of the big things with fill in the blank is making sure you're paying attention. If it's saying, round to the nearest whatever, make sure you pay attention if it's telling you to round. Know your rounding rules. And we all know our rounding rules, correct? If it's 5 or up, round up. If it's 4 or down, round down. Okay. Yeah, so that's fill in the blank questions. The next type, and I talked about this, I believe, last week, select all that apply. Or multiple response, depends on what they say. But it's all basically the same thing. Multiple response or select all that apply is where you have a question and then you usually have about 5 to 6 answer choices. And what you have to do is literally select all the true statements for that question. My weakness, I know, it's okay. So yes, you have to check and select all the true statements for that question. Now, the tricky thing and the annoying thing about select all that apply is that you won't get partial credit for partially correct answers. Like, for example, if the answer choice is 1, 2, 4, and you put 1, 2, 3, and you think, oh, I got 2 out of 3 correct, I should get like partial credit. Absolutely not. No, it's literally all or nothing. If you don't get the correct answer right as a whole, then you don't get any partial credit. It's marked incorrect. Okay. So instead of having missing those usually by 1, me too. And the other thing about select all that apply is, like I said, you have 5 to 6 answer choices, and it could be as little as 1 of those that's correct, and as many as all. So it's either 5 or 6 usually. So it can be as many as all of them are correct, or as little as 1. What? I can't tell y'all how many times like I've had a question where all of them have been correct, and I'm sitting here looking at it. I'm just like, there's no way this can be right. Mind you, content-wise and comprehension-wise, like I'm choosing all the correct answers that I think it is, and I'm just like, I've never seen it, or I've never seen them all the same answer. Do you guys do that when you look at the actual question? Like if it's too many C's in a row, you're just like, let me change one because it can't be this. Do you guys do that, or have you ever done that? I was really bad at that in my first semester. I was like, there's no way it could be this. The past like 8 answers have been B. So it has to be something else. So maybe I'm wrong and I'm changing my answer. And then it turns out I'm wrong. That's another thing. And another test taking strategy. Go with your gut. Go with your gut. Do not change your answers, because the majority of the time when you do change your answers, you're actually getting it wrong. You're changing it from the correct answer back to another answer, and that's because you're overthinking it or you're freaking out, and you just end up changing the answer because you've literally talked yourself into a circle and out of what your gut and your body and your mind really knew what it was. Let me see what y'all saying. Right, great. Unapologetically said I used to, but I got in the habit of, if I feel it's right, I don't change my answer. Period. That's all about confidence. That's test anxiety all the way through. All right, when you start to overthink and then you change your answer and then it still ends up being wrong, that sucks. So, go, when you're answering your question and you select the answer, select it confidently. Know like, okay, I'm going to choose this answer based off of what I know, and I'm just going to go to the next question. Don't go 3 questions ahead and be like, okay, let me go back and change that answer. Go with your gut. Okay. Another question type, ordered response. Ordered response. That's when you have to put the answer choices in order depending on whatever the question is asking you. Usually it'll be like procedural, usually like procedural. Like, what are the steps to washing your hands? What is the step to putting on PPE or taking them off? And you'll have to correctly order the responses. They'll give you the responses like on one side, and what you have to do is drag and drop to the other side. My main test taking tip for ordered response is to make sure that whatever you're dragging ends up where you want it to end up. Because sometimes when you drag and you drop it, you may want to drop it as number 2, but that thing will just boot up to number 1, and it'll just throw everything else off. So just double check anything, but definitely double check your ordered response to make sure that it's ending up in the spot that you want it to end up in. Okay, so usually a specific order. So you want to make sure that that specific order is specifically how you want it to be. Okay, the next question type is figure and hotspot. That is basically when you have an image and then you're going to have 2 to 5 clickable hotspots. And let me give you an example. Okay, first of all, this is our first semester study kit, so I'm just going to be using this just to give you guys an example of a hotspot. Okay. So let's say this one. Okay, first of all, I didn't mean to go to the pressure hotspot page, but this is a perfect example, okay? So you'll usually have an image. For example, if you have a question and it's asking you to identify, let's say pressure hotspots, on an image, like I said, you'll have about 2 to 5 clickable hotspots, but they won't be circled. You won't know what the hotspots are. So they'll ask you to identify a certain aspect or part of this image, and your job is to click on the hotspot or the answer of whatever they're asking you to identify. That's usually really big on when they're trying to have you like identify something's anatomy. So I know for me, the one I specifically had that I remember was like the picture of an ear, and the hotspot was for me to identify like the pinna. It had literally the picture of anatomy of an ear. And I guess there was, I don't know how many hotspots there were, but when they asked me to identify and click on the image where the pinna would be, I know what to do. So that is an example of a hotspot question. Oh, wait, hold on. Let me see what y'all saying. No, as somebody says, the NCLEX typing now, that's just one of the types of questions. It'll be fill in the blank as far as this question. It's usually math. So Some say I really thought it was all multiple choice. Unfortunately not. Ooh, that's why you are here with test taking strategies, because I promise you would have went into that thing mad as all hell. It's not. And we won't talk about the next generation NCLEX today. That's specifically for Saturday. But make sure you attend that next generation live, where I'm giving you guys the tea and the scoop on that. Especially if you're taking your NCLEX in 2023 or later, you want to be there, okay? You also have like chart/exhibit questions, and that's pretty self-explanatory. You'll have a chart, and you'll need to usually it'll literally be a patient's chart, so or an example of a patient's chart, and you'll need to flick through the tabs. Usually it's like labs, meds, history, and the little interactive chart, and you just click the tab so you can know what information it is, and then it'll ask you whatever question, and you have to answer based on whatever the chart says. 7 o'clock. It is 7 o'clock on. We can go back on the NCLEX. No, you can't go back in your NCLEX, but I'm saying some people's like their nursing school programs. During the nursing school program, they'll have their regular semester exams, and usually you can go back on those. I know I could back on mine. That was like 8 years ago. But on the actual NCLEX, no, you can't go back. All right, great. All right, so with those types of questions, hold on 1 second. Yep, we talked about drag and drop. Perfect. Okay, so with majority of those question types out of the way, let's get into the actual test taking strategies for the NCLEX and those questions. So now that you know the types of questions you're gonna get, let's talk about the actual strategies for those types of questions that you can implement. All right, so like I said, last we talked about select all that apply, and a lot of those tips you can use on any type of NCLEX question. One of the ones that I always, and I say this every Tuesday, every NCLEX Jeopardy, I talk about these specific tips all the time, but one of the main tips that I want you guys to take away for multiple choice, or even multiple response. So for multiple response and multiple choice, if you have an answer that is the same, essentially, or connected/linked to the other one, it either is that answer, they're both correct, or neither of them are correct. Does that make sense? So for example, if you have a question, whatever it's asking, and the answer choices, you have one answer that is fluid volume deficit, and then you have another answer that is dehydration. Those are linked. Fluid volume deficit is synonymous with dehydration. Does that make sense? So if you have a question and it's asking you, for example, it's asking you, you can expect the pulse to increase, I don't know, with which of the following conditions. And then if you have fluid volume deficit and like dehydration, and then you can also say like hemorrhaging, all those three, even though they're three different terms, they're basically saying the same thing. Your fluid, whether it be water content or blood, that volume is deficient. So that's either dehydration with the water content, or if you're hemorrhaging your blood, then it's also, like I said, in deficit. Let me see what y'all are saying. There's a new generation of NCLEX coming out. It is in 2023. Okay, let me look and see what it's saying. I've been away from being a bedside nurse for about 2 years. All right. So does that make sense as far as the same types of questions? Now, invertly, The same applies for opposite responses. Okay, if you have, whether it's multiple choice or select all, if you have two or more question types, answer types, and they're the opposite of each other, then more than likely one of them is correct. So if you have a question and it's asking you, something about blood pressure, and one of the answers is hypotension. Hypotension versus hypertension. If you have answer choices, one's hypertension, one's hypotension, those are opposites. So whatever the question's asking, is the blood pressure going to be low or high? The fact that you have those opposites is kind of like a telltale sign that one of those is correct. Those are really popular with like just multiple choice questions where you have 4 of the answer choices, and you can very quickly narrow down what you think the correct answer is, just based off the fact that you're identifying that there's 2 opposites. Okay, does that make sense? How do you get better at your critical thinking skills? Practice. Practice, practice, practice. So when people say you need to practice those practice questions, do that. Do that. All right? Okay. So yes, you want to practice always makes perfect, or as close to perfect as possible, as far as developing your critical thinking. You can't really read a book and just be like, oh, I can critically think now. That comes with time and practice. Okay. Next tip. Whenever you have, my notes. 1 second. Okay, next question or next tip. Whenever you have a question that's asking you for the priority. Let's talk about priority questions. All right. Whenever you have priority questions, and you'll know that they're priority questions just based off keywords. They're asking you about what to do first. Which patient should you tend to first? They're asking you, that's a priority question. Okay. Number 1 tip. Wait, hold on, let me see what y'all saying. Probably remind yourself, as far as the live notifications, remind yourself that whenever I post it, I don't know that I'm going live. Usually I'll post a reminder in my story, and then you can just click on set reminder. All right, so for those priority questions, okay, you want to think about a couple of things so you can figure out where and what you should do / go to first. All right, you will always want to think about your Maslow's needs. Okay, you have like those basic needs take priority over other higher needs. So you remember, you have the Maslow Hierarchy. Okay, everything at the bottom is more priority than what's at the top. Okay, so air, food, being safe, water, shelter, those are priority over what time is Jocelyn's Cabaret coming on tonight. Like, does that make sense? Like, you need air, water, food. You need those things. Some people may need, but you want to know when, you want the latest jeans, you want the latest Jordans, or whatever the case may be. Those aren't priority needs over what's actually going to keep you alive and functioning. Okay. The next thing that you should think about as far as priority questions is your ABCs. I think somebody said this earlier, your ABCs: airway, breathing, circulation. So if you have a question and you're trying to figure out what to do first, or what issue to tend to first, think about those 3: airway first, breathing, circulation. So if you have somebody and it's like usually like a triage question. If you have a patient that is choking versus a patient that got a paper cut, who you can go to first? The choking, right? Because their airway is being what's the word I'm looking for? I just lost the word. Their airway is in jeopardy. Yeah, sure. Versus the paper cut, it doesn't matter how deep that paper cut is, okay? Unless they have hemophilia. But airway is always going to take priority over, and breathing over circulation. So that paper cut would be a pain issue and a circulation issue. You don't know right off the bat if they have maybe a bleeding disorder, but be due to the ABCs, airway, breathing, circulation, that choking slash air, first of all, it's airway and breathing. All right. Compromise is the word I was looking for. If their airway is compromised and they can't breathe, that's definitely going to take precedence over the bleeding and the circulation of a paper cut. Does that make sense? So that's the type of thinking that NCLEX wants you to do, because they're testing you for the real world. Like if you have a patient that does this, or if you're in a situation and it presents like this, how are you going to respond? What's the correct way for you to respond? So they're training you with those priority questions. The next thing, always remember your nursing process. All right. Nursing process. Do you guys know about the nursing process? What is the mnemonic? If you're in nursing school, but what is the mnemonic that helps you remember the nursing process? It's usually the same thing, but somebody type it in the comments below. What is the mnemonic that helps you remember the nursing process? ADPI, absolutely. ADPI. All right, so ADPI, what does that stand for? I always forget the D. Don't make a joke about that. All right, so ADPI. The A is assessment. The D is diagnosis. P is for planning. I is for implementation. And E is for evaluation. All right, that is going to be the acronym that represents the 5 stages of the nursing process. Okay. Usually you learn that in like fundamentals, because that's fundamentally what should go through your brain whenever you're thinking about doing anything that requires, within your nursing role. All right. You have to think like a nurse and go through that nursing process. So you have to assess, diagnose, plan, implement that plan, and then evaluate. So it's very similar to like a scientific method. All right. So the ADPI is basically the nurse's scientific method or way of conducting whatever it is that they're conducting. They have to assess the situation first. So this will be very helpful whenever you have questions, and it's once again asking you priority questions. What should you do first? You would, before you before you plan how you're going to fix a problem, you have to observe a problem first. Does that make sense? Remember, assessment is first. So you have to assess the situation, observe whatever it is that you need to observe. And from those observations, that's when you make the diagnosis. All right. And when you have the diagnosis, that's when you can then make the plan. All right. And then once you make that plan, the next step is to implement that plan. So what action steps do you need to do that you came up with in that plan of that diagnosis based on what you assessed and observed? All right. So same thing as gather data. Next thing is you would evaluate to see if it even works. Okay. So whatever it is that you observed, the diagnosis, you came up with a plan, you implemented the plan, you took action. Now you got to evaluate and see if whatever you did made a difference. Are they the same? Did they get better? Did the problem get worse? Evaluate. Okay. And that's how you can, and that's usually how plans of care are tweaked and adjusted based off of what that plan, or how effective that plan was and the steps that you did due to that plan. All right. So that's what you have to go through in your head. ADPI, assess, diagnose, plan, implement, and evaluate. Okay? Mind you, y'all know tomorrow's Thursday, so tomorrow's NCLEX Jeopardy. So everything that I'm saying and all the test tips that I'm giving you guys now, I want you to make sure that you're really listening so that tomorrow y'all can come to NCLEX Jeopardy. It's going to be straight review. And even if you don't know some of the content, like I said, even if you don't know some of the content, you'll be able to use these test-taking strategies that I'm giving you here to help you, okay? NCLEX Jeopardy is our weekly practice for NCLEX style questions. So and we do it as a group. So that's definitely what you want to come in. I'm losing my voice. Hold on. Yes. Baby ASAD. These tips work for exit exam also. Is that a question or a statement? Should be statement. Because yes, that's very true. The exit exam is basically baby NCLEX. I'm going to just say that. The exit exam is the predictor test for how successful you're going to be on the NCLEX. And both of them are testing you on your clinical judgment, your critical thinking skills, and if you know how to meet a client's needs, because remember, that's the objective of the NCLEX, meet clients' needs. So they're trying to make sure that you can meet those clients' needs in a safe and effective manner. So that's what the NCLEX is testing you on. And if the exit exam is predicting how well you'll do on the NCLEX, it's testing you on that as well. So a lot of people use, and just like NCLEX, the exit exam is comprehensive. So I've had a lot of people use like the Ultimate Nursing School bundle, and they come to NCLEX Jeopardy and use all the NCLEX books to help them with their exit exam. What is wrong with my voice? Oh my God. 1 second. All right, you're back. Took on the 13th and passed the grade score. Awesome. Perfect. Okay. And you guys know that just in case, somebody said they're going to be in class, but just in case you can't be here for the live NCLEX Jeopardy, you guys know you can download the Nurse Sam app for free and then play the questions that we're going to, well, right now you can play last week's questions, but tomorrow after we do live, just in case you miss it and you want to still have that practice in, you get 25 new, you get 25 new questions every week, every Thursday. So even after we go over it, and the only reason why I don't upload them at the same time is because we usually play for prizes. So after we get finished with our live, then those questions are then uploaded onto the app, so you can play the mobile version of NCLEX Jeopardy. Someone said, you got to get something to drink. You've been talking for 3 days. No, seriously, yes, I have. But once again, I'm just making sure y'all have everything you need, because I know it's finals week. Y'all preparing to take whatever exam. So I just want to make sure y'all have everything you need, okay? I also gave y'all 30% off everything store-wide, so you can get whatever resources you need, whether that's the Ultimate Nursing School bundle, the ATITs bundle. I suggest, especially if you're in nursing school, I suggest just getting the Ultimate Nursing School bundle, because it contains majority of the study kits. It doesn't contain ATIT stuff, because that's just a separate, it has its own bundle for those things. But the Ultimate Nursing School bundle, it's 400 pages, and it's going to include your fundamentals, maternity, peds, med-surg, pharmacology, dosage calculations, mental health. It's going to include all that in that bundle. So whether you're about to start first, second, third, however, whatever number semester, the Ultimate Nursing School bundle is going to accompany all that. Okay. Perfect. Okay. We talked about question types. We talked about priority questions, the nursing process. 1 second. We talked about opposites and the same. Let me see what else I am missing. Like I said, if you guys are taking the NCLEX in 2023, make sure you are here on Saturday at 7 p.m. for a live, where we're going to be going over all things next generation, the NGN NCLEX. Okay. Another test taking tip: avoid what if. Okay, a lot of people will go and they'll read a question and try to answer that question based off of personal experience, what they saw, their mother or auntie go through. And that's just not a good strategy for answering these questions, because everyone's different. All right, so everyone's going to experience different symptoms. Everyone's going to react differently to different medications. So you can't go based off of, solely what your personal experience is. Okay, so you don't want to read into the question and overthink it. All right, you want to focus only on the information that the question's asking you. You want to look out for strategic words. All right, and by strategic words, what I mean is the words that are going to hint at the type of question. Like, for example, when I said what I said about priority questions. If you're reading the question and there's the question's asking, which one should you do first? That word first is a strategy word. It's a strategic word, and that's going to hint and let you know that what the type of question is a priority question. Okay, so that can help you answer it based off of the tips that I just told you guys about priority questions. Those Maslow's needs, nursing process ADPI. And mind you, these tips can be used whether you're taking the NCLEX PN or the NCLEX RN. Okay. Another tip, you want to eliminate closed-ended words. All right, so, or absolutes. Let me say that. Closed-ended words or absolutes. So whenever you see or answer choices that are like all, must, never, every, all-encompassing words like that. Someone said or ATI. Honestly, any test. But yes, or ATI. All those words are closed-ended words. Okay, you want to eliminate any option that has any of those words. Like I said, all, only, every, never. What that is, it's fixing whatever it is that it's saying and saying that it's concrete and like an extreme meaning, if that makes sense. So if it's like, they're usually incorrect because it is fixed and just very extreme. So what that usually, let me give you an example of one of those closed-ended questions. Let me see if I have one. I'm trying to find out a question where you can't. Closed-ended words. Okay, so for example, I'm gonna read you guys an example. I don't know how else to simplify that. Usually closed-ended words, it doesn't allow for any type of flexibility. And with nursing and medicine, you guys know that's usually flexibility. So usually if you have closed-ended words, what you should do is look for those open-ended words. So like I said, closed-ended words are all, these are these absolutes. All, most, always, like you always do this. Have you ever like heard that or said that when you were arguing with somebody or arguing with a partner and someone tells you like, oh my God, you never do the dishes, and you're just like, calm down, I literally didn't do the dishes 3 times. Like, don't make it seem like that's such an absolute. The same thing kind of applies. Obviously not with washing dishes, but the same thing applies. There's no way to really say like you always do this, and if there is, it's usually not correct. So what you should do, like I said, is look for open-ended words. Like the correct way to kind of phrase that would be correct is you usually don't wash the dishes. Not you never wash the dishes. You see that difference? Never is absolute, and usually is letting you know that, majority of the time it happens, but there's still some flexibility in it, saying it's not fixed to whatever it is it's describing. Does that make sense? Does that make sense? So whenever you see those open-ended words, veer towards that as far as the correct answer, because like I said, the closed-ended ones are usually incorrect. All right. What else? We eliminated alike/opposite answers. Next one. Oh, another test taking, and really a study tip. Whenever you have pharmacology, a lot of people would be like, how do you remember all those meds for pharmacology? Because you're going to learn a lot, okay? My number one pharmacology study tip is to definitely learn and study the class of medication versus every individual drug. Does that make sense? So while you may have to do drug cards on individual cards just so you can kind of, supplement your the comprehension of that material, but whenever you're studying and having to, especially prep for the NCLEX, whenever you're having to comprehensively kind of remember certain medications, go for the classification. And a good way to think about or understand what the classification of a medication is to look at the suffix. Okay, what is it? The prefix too? It's usually the suffix. For example, I had a question on my Instagram a couple weeks ago. If this month, the month that we're in right now, was a class of medication, what would it be? Answer right here in the comments. If this month, the month that we're in right now, was a class of medication, what would it be? What month are we in? April, right? April. If April was the name of a medication, what class would it belong to? Knowing your suffixes. What class of medication would it belong to? What class of medication would April belong to? Keyword being the Pril in April. If you see the if you see the suffix, what are y'all answering? If y'all see the suffix Pril on a medication, that lets you know that it's what type of medication, what class of medication. It is antihypertensive, but specifically when you see Prils, no one's saying it. ACE inhibitors, guys. ACE inhibitors. And why? Because ACE inhibitors usually have the suffix Pril. I almost said, thank you, cow booty butt. No, beta blockers are LOL. So that's why I said one of the big tips for pharmacology is to make sure you are paying attention to the class of medication. Okay? ACE inhibitors, you have, like I said, because ACE inhibitors have Pril as their suffix, you can have lisinopril. What's another Pril? What's another Pril? Lisinopril. Wait. It's really going to bother me. 1 second, because I was saying that. What's another example of a Pril? ACE inhibitors. Inhibitors list. Wait for it. Enalapril. Thank you. Okay, y'all. Giving me extra ACE inhibitors. Yes. Enalapril, Catepril, benazepril, lisinopril. If it ends in pril, it's an ACE inhibitor, which is a type of antihypertensive drug. All right, so that's an example of critically thinking. Okay. Lauren said I was typing it out. I understand. Exactly. Yes. And somebody said beta blockers. Beta blockers is LOL. I think it just, honestly, I think about LOL, laugh out loud, but beta blockers is usually OLOL, whatever you want to call it. So metoprolol or give me another beta blocker. Guys suck. Just kidding. All right, atenolol, that's the word I was looking for. So atenolol, metoprolol, those are all examples of beta blockers because they have that same suffix, which is OLOL, or you can just say LOL. Laugh out loud will help you remember that. So that's an example of how suffixes can definitely help you as far as classification for pharmacology. Okay. Right. Exactly. So that is basically the gist and the main idea of those test taking strategies. Okay. I'm gonna have some questions up in my story to help you guys kind of practice that, because going over it and listing out let me see what y'all saying. Whoa. Labetalol. Okay, labetalol. All right, so going in and just talking about those test taking strategies, like I said, it's only half the battle. Okay, what you now need to do when you understand the content and then understand the strategy behind the questions and how to answer them, then your next step is to practice. Okay, and honestly, the best way to really make sure you comprehend that information is to practice. So come to NCLEX Jeopardy. We practice every Thursday. Okay, as a group, we go over the rationale step by step, and that really helps you to retain the content and to really comprehend it, so you can recall it at a later time. If you have those Saunders books, usually they have codes where you can scratch off, like little codes on the inside where you can scratch off and utilize their online content. And they usually have like thousands of practice questions. And you can usually sort it based off of whatever you're weak at, whatever your weakness is, certain areas, certain chapter contents. Like if you want to just have a test where you're really practicing priority questions, you can do that. If you want a text where you're practicing select all that apply, you can do that. Okay, so make sure after you do these tests, go back through and see what you got wrong, see what you can strengthen. Okay, and when you have that information mixed with the knowledge of the content and the strategy, then you can go, and your learning style, then you can go back and really dive into whatever material it is, and not necessarily just read through it again, but really refresh it in your memory and do it in a way that's congruent with your learning style, so it really sticks. Does that make sense? Boo, boo, boo. Yes, Saunders is awesome. Do I have anything for anxiety? Yes. I have there's a free ebook in my link in my bio where I talk about how you can overcome test anxiety. I should actually post that as well, especially because it's finals week and a lot of people suffer from that test anxiety. And when you have test anxiety, you can know all the content, all the strategies, but sometimes with test anxiety, it's really crippling. So you get there and you just get so nervous and anxious that everything that was in your mind just kind of erases and it's wiped clean. Because you panic and you overthink. So there are ways that you can manage your test anxiety. I have test anxiety. I had test anxiety throughout nursing school. So these tips I definitely had to learn back then, and I still apply them now for just anxiety in general. But I'm not really taking any tests. But those strategies that I use to really help me overcome my test anxiety really helped me. So I put that in an ebook, and it's for free. Link in my bio. Okay. I'm not gonna lie. It's okay. Lauren comes to NCLEX Jeopardy every week, so that's another example of practicing. All right, that practice makes perfect. When you make that practice a part of your daily life, you won't feel as anxious and you won't feel as unprepared. Half of that anxiety is coming from the fact that you're not as prepared as you need to be / want to be. But when you know that you're really prepared and doing what you need to do, then the anxiety, I'm not saying the anxiety is going to be gone, because some people are just anxious people, but it definitely won't be as bad if you go in there knowing, okay, I know I did this. The anxiety that probably still lingers is just that normal anxiety, like, oh my gosh, I'm about to take this test, I'm about to take this final, yada, yada, yada. There's so much that's going to be, writing on this grade. That's just natural, anxiety about a very important test or something very important to you. But you can, like I said, you can manage it and lessen how it affects you negatively when you're able to identify the signs and know what to do when you start feeling it. Those breathing exercises, and just doing whatever you need to do prior to taking the test to make sure your confidence level is up and that anxiety level is down. Your future science, a prayer meeting. I'm not doing this with you. You got your shouting shoes in the trunk? Wait, hold on. I think somebody said... somebody said I passed my NCLEX using your NCLEX guide. Yay! Awesome! I took a screenshot. All right, awesome job. So proud of you, Janaya. I wish I could. Let me see. I almost passed out walking there to take my test. I remember using your breaks when you get anxious. Absolutely. Janaya said I almost passed out walking in there to take my test. I recommend using the breaks when you get anxious. Absolutely. They give you breaks, and whether or not you feel like you need that break, sometimes you need that mental break. Just take a minute to breathe, or however long the break is, to breathe and refocus and recenter yourself, not solely for the fact that, okay, let me remember this, but you need to calm yourself down, especially if you know you have anxiety. So just kind of zen yourself out during those breaks. That was a great tip. Absolutely. Here we go for the best you can be. Awesome. All right, guys. So that concludes our test taking strategies for today. Tomorrow, we will be having our NCLEX Jeopardy. Okay. So your content and your strategies they're going to all come into play as far as being able to answer the NCLEX Jeopardy questions. These are NCLEX style. We do play for points. Okay, the winner usually wins a free Ultimate Nursing School bundle. It is regularly $97, but even for this whole week, you can get 30% off if you use code FINALS30 at checkout. Mind you, the code is good for the entire store. It's store-wide. So whether or not you need the Ultimate Nursing School bundle or the ATITs bundle, you can get 30% off using code FINALS30. All right, and that's for the rest of the month until 11:59 on Saturday. Okay, so I suggest you go ahead and grab that up while you can. Run, don't walk. And then have that with you so that tomorrow at 7 p.m. right here on Instagram Live, when we're going over NCLEX Jeopardy, you'll have everything that you need, especially if you're a visual learner. Okay, so it is perfect if you are a visual learner like me. All right, and just need something just fun and entertaining to keep your interest and keep you motivated to continue studying, and B, the familiarity of it, especially because it's usually like themed and inspired by something else that's associated with it. For example, the maternity study kit that's within the Ultimate Nursing School bundle is baby shower themed. Okay, so I usually have themes that really help to make it more animated and make it literally more entertaining so that you're able to retain more of it, especially for my visual learners. Okay, so like I said, you can go ahead and get that now if you use code FINALS30 at checkout. That's for both online, on the app. The app is the NurseSam. The NurseSam. That's the app. The website is thenursesam.com. Click the link in my bio for access to all of that, and I'm going to also make sure that the link to the how to overcome test anxiety is also there for everybody that has test anxiety and want to kind of learn how to manage that as much as possible. Alrighty, so once again, tomorrow's live is NCLEX Jeopardy. This is for RN, LPN students, everybody. Okay, so tag a friend, bring a friend, and I will see you guys tomorrow at 7.